I might take a little bit of a contrarian view on this one, that it's like either it takes too much or we're actually over-educating them, and we're over-educating them and sending them right out. So I think the real struggle in my experience that I've seen is that we're actually not educating patients in a way that they understand. And so we use scientific terms, we use dental terms, we use all of these things that are not familiar at all to patients. And we think if we use our fancy words, it's going to help convince them to do treatment. And so, I remember being a hygienist in the chair and thinking if people just understood perio like I did, they, of course, they would want to do this $1,000 scaling and root planing, and then they'd want to pay extra money for perio trays and do whatever. And so I remember literally remember explaining to people what a gram-negative anaerobe bacteria was. And so I tell hygienists all the time, if gram-negative anaerobe comes out of your mouth, just stop. You've gone way too far. Take a step back. And so it's actually about simplifying things. Mrs. Jones, did you know that you have an infection in your gums? Oh, no, like, oh, yeah. And I have lots of patients, they didn't know they had an infection in their gums. And if left untreated, that's going to lead to bone death and tooth loss. Does that does that concern you? So it's actually about using analogies and metaphors, helping people understand treatment in a way that makes sense to them, and actually connecting what's happening in their mouth to what's happening in their lives. I mean, so many times people have something far more important going on, or they're in the middle of some life event, and we're trying to convince them to do scaling and root planing, and they're just not ready for it. And so I think that we do a disservice to our patients in the way that we talk to them and often the way that we treat them. I don't think that we respect their choices enough. I don't think that we give them what they want enough. And I don't think that we communicate in a way that they understand. And I also see where we struggle to communicate in a sense of urgency, where I've listened to even like new doctors would, before they have confidence in themselves, they'll say things like, hey, you kind of like, you got a little fill, you got a little cavity back there. You might want to think about, considering maybe you want to get that taken care of, rather than, you know what, you've got a cavity, there's a hole in your tooth, and if you don't get it taken care of, it's going to lead to greater decay. So, would you like to get that scheduled today? Right. So I think that our communication is either too soft or too scientific, and we have to do a better job of helping our patients understand our language.